Hello, and welcome to this week's episode of GIANT's Healthy Innovators TV. My name is Barry Shrier, and I'm your host. These weekly episodes are sponsored by GIANT Health. We invite our community from around the world to go to our website, www.giant.health, to learn all about us. GIANT is a global community of nearly 200,000 people. Everybody around the world whose business is healthcare, technology, and innovation. What we like to do every week is we like to bring together some of the leaders from around the world who are driving at the forefront of innovation in healthcare. We all share the same goal, which is to improve healthcare outcomes, to achieve better healthcare services at lower cost, and to improve the health and well-being of people around the world. So thank you to all of our listeners from around the world. We'd also like to thank our sponsors. Thank you to McKinsey, our knowledge partner. Thank you to Barclays International Bank. And thank you to our telecom sponsor, Vodafone. We love working with you guys and all of our partners and collaborators. So thank you very much for your support. So today I'm very excited to introduce you to Andrew and Paul from Moby Clinic in Africa. Hello, Andrew. How are you today?
I'm okay, Barry. I'm very excited to be here.
Excellent. Really glad to have you on board. And likewise, Paul, good to see you. Thank you very much for joining us. How are you?
I'm very good, thank you.
Good stuff. Hey, well, look, we have an incredibly important, interesting subject to talk about today, which is about the status quo of African healthcare and access to healthcare in Africa. So let's dive straight in, if that's okay. So, Andrew, tell us a little bit about that subject, please.
All right. Thank you, Barry. When we come to talk about the status quo of healthcare in Africa, it is a very touching subject, and particularly for me, because my passion is about health equity. I believe that health equity is a great tool for social justice. My background is small, but I'm very passionate about health access and equitable access for all. So the status quo in Africa is quite devastating. Just to start with the global scene about healthcare, it is quite disheartening to note that we have 3.8 billion people in the world who lack access to basic health services. And this is according to a report by the World Economic Forum on Global Risks, a report of 2018. And this report noted that half of the world lacks access to basic health services. And many of these people are coming from developing countries. And you know for a fact that Africa, almost all the nations, the countries are still categorized as developing world. So when we come to Africa, we have over 850 million people who live in last mile areas and rural areas, and these struggle with access to basic health services. And on our end, in Moby Clinic in Uganda here, because Uganda is no different, we realize that the problem is twofold, that people face a problem of long distances from to health centers. Imagine when you're sick, but you have to walk over 10 kilometers to the nearest health center. Wow. It is, it is a very tough situation. And also, when we interrogated the problem, we realized that Uganda, just like other African countries, has few medical workers, few health workers, and yet the population is big. So that is those two are the main sources of the problem, of the difficulty in accessing healthcare. And whichever solution has to come up, it has to adequately solve the root causes of those problems. And as we will see later on, this is what Moby Clinic is coming to do. Yeah.
Excellent. Well, Andrew, thank you very much. I mean, these issues are profound, and the facts that you have just highlighted regarding the vast numbers of people around the world that are affected by this, and of course, the challenge of inadequate healthcare provision, inadequate healthcare workers, and so forth. Paul, on that theme, what do you think are some of the misconceptions that are out there? Are there misconceptions which we ought to be taking steps to address here as well?
The sense is, Barry, building on what Andrew said, one of the big things is cost. This is where technology and innovative thinking really comes to the fore.
Right.
Because as Andrew has said, 10 kilometers is 10 kilometers to walk,
Yes.
possibly without a decent pair of shoes. But when you get there, can you actually afford a consultation? I just dug back in because we're talking about nearly 1.5 million Ugandans living in extreme poverty being something like less than $2.12 a day. And then I thought, well, hang on, let's just have a look at the rough guide for the backpackers who might choose to wear a pair of sandals and go walkabouts to discover this type of place. And the rough guide recommends $20 a day just to buy food and drink. So if I'm a mother with a sick child, how can I afford healthcare when I've walked that distance? And so one of the big misconceptions is that that even when we are making things available, they're not accessible for people who are, as you have written just recently, as people are thinking more about their more rounded well-being. And we'll come on to this as well with the COVID crisis, where we think about well-being as much as responding in terms of curative healthcare.
Yes, exactly. Well, thanks, Paul, for that additional input. I mean, these misconceptions are quite profound, especially, I think, for people who live in the developed world and do have ready access to healthcare and aren't aware of the big numbers, as you've mentioned, Andrew, the lack of healthcare, as well as the affordability, Paul. So I think that's very interesting, and that leads me to wonder a little bit about Moby Clinic. So Andrew, if you can help our listeners by way of introducing Moby Clinic and telling us how it came about and what is the focus of Moby Clinic, please.
All right, thank you. So Moby Clinic, first of all, I founded Moby Clinic. I'm the chief executive officer and the founder of Moby Clinic Uganda. With me on here, Paul is the chairman of our advisory. So we're glad to share with you about Moby Clinic. Now, as I mentioned earlier about this huge problem of healthcare globally, despite the fact that billions of dollars are injected in global healthcare annually, and yet a significant amount of people across the world lack access to basic health services. So it adds up that something is not being done right. And this is where Moby Clinic comes in. Moby Clinic comes to offer a solution that is practical and solves the entirety of the problem. And this is what we are doing and been piloting in Uganda for the past 3 years. So, like I mentioned earlier, that the problem is twofold. Number one, the health centers that are built by the government are quite often very far from the people. Remember, the government framework is that for every 250,000 people, they build one health center. So, want it or not, it will get overwhelmed. And still, in this instance, they are often built very far from the people. So, what do the people do? The people resort to local means of survival. When they have malaria, they will not go for checkup. They will self-medicate. So there is a lot of medication with local herbs in the communities. And what do the pregnant women do? They go to what we call traditional birth attendants. It will shock you to know that in Uganda, every hour there is a pregnant woman dying. So on a daily, we have over 25 women, according to the Ministry of Health statistics, who die every day while giving birth. And many of these are coming from these low-income communities who cannot afford access to healthcare. So what does Moby Clinic do? You will realize, you will agree with me that the right to healthcare is the same as the right to life. When you deny a right to healthcare, you have literally denied them a right to life, you know? So their life every minute is on the verge. So what does Moby Clinic do, having known all this depth of the problem? Moby Clinic works in two ways. Number one, it empowers community health systems. We recognize that the numbers of medics, of doctors, is not going to increase overnight.
Sure.
So we say, let us decentralize and democratize healthcare. Let us involve the communities to partake in their own healthcare. Let us create first-line respondents in communities, such that if Barry is stuck in a rural area in Uganda, Barry does not need to get worried about the many kilometers before he gets attention, healthcare access. But
Yes.
Barry now know that within walkable distance, there is a first-line respondent who we call a community health provider. Now, that's the way we solve this. And then the second way is that we recognize that these first-line respondents, their level of training is to a certain limit. So because we are aware of that, we create what we call a digital safety net. And now at Moby Clinic, what differentiates us from other organizations and companies across the world when it comes to community health is our concept of a digital safety net. Now, our theory of change is leveraging this digital safety net to revolutionize health delivery for low-income communities.
Superb.
Now, how does the digital safety net work? When Barry, who is sick, goes to a community health provider, the community health provider will help Barry according to the basics they were trained, you know. But once they are stuck, that's not the end for Barry.
Right.
The community health provider will utilize our digital innovation, our mobile app called the Moby Clinic app. And our app is exclusively built for community health workers, these community health providers, so as to ease their service delivery. So once the community health provider gets on this app, our app offers three things. Number one, the digital safety net, whereby they can interact or consult from senior medics, you know, while offering the service. And then number two, it enables emergency responses. It lists the numbers of ambulances that are nearby. And then number three, it enables integrated referral system. Barry, you should know that in the communities, Moby Clinic is very collaborative and not competitive. We work.
That's very important. I think the issue of collaboration compared to, competition, so to speak, can be quite a problem. Andrew, thank you very much for the initial introduction to Mobiklinic, and very, very exciting to hear about it, and we appreciate that. Paul, would you mind adding, please, how did you first meet Andrew, and what is your role in Mobiklinic? That's the first question. And the second thing, Paul, I'd like to ask you to help our listeners to understand is, from an international perspective, a lot of the audience looking at our weekly Healthy Innovators TV show are from around the world. And so what are your thoughts on the international aspects of this, and what can our listeners do to support Mobiklinic, for example?
Yeah, Andrew is the epitome of an entrepreneur. Personally, he has had those experiences, and please, for the people listening to Andrew and getting his passion, go and look at his profile and look at Moby Clinic's profile. I was introduced to Moby Clinic and Andrew through the Entrepreneurial World Cup some 2 years ago.
Oh, wow.
And I was asked to assist three organizations, of which Moby Clinic was one of the great successes. There was something in excess of 176,000 entries globally. Moby Clinic were into the last 200. And wow. Andrew was a gentleman who was in his early 20s, and already mature enough to be having conversations as if he'd got 20 years of business experience. So it was a joy to be able to become a part of his back office and take forward Moby Clinic. I'm not a health professional, not in the least bit. Andrew is fully aware of his skill sets and has brought in some 20 people additional to the Moby Clinic core.
Yes,
He's already explained regarding the community health workers and the support team that enables not just the technology but the technical aspects. So we've got Clark University, for example, who are supporting quality health professional input. Andrew could see this, and so he brought in a further 20 people to work as non-executives and specialists in the background, and I'm part of that team. So the sense is, to answer your second point, Barry, is we need a change of gear. If we just flip back to late 2019, early 2020, when there were clarion calls that Africa would be decimated by COVID, and we would see tens of thousands of deaths. The death rates, the mortality and morbidity rates directly to COVID, I don't know, but they certainly haven't exceeded the other killer diseases that we continue to face across. I'm sitting here in Nairobi, across the border in Kenya. Malaria, HIV, AIDS, TB, diarrheal, waterborne diseases, and respiratory tract infections are still the biggest killers across most of sub-Saharan Africa. What we are seeing often is people marketing solutions, looking for problems to fix onto. What Moby Clinic have done is seen the problem and develop the technical and tactical solution to be able to address, first off, the questions of antenatal and postnatal care.
Yes.
But because of the platform being put in place, its capability to offer the digital framework for digital health and do the outreach can be built on. And that we will come to as well, because once we build the platform, then clearly the case is it becomes a partnership and a need for holistic approaches, Barry.
Yes, exactly. Yeah. Paul, that's extremely interesting. Thank you for your contribution there. These issues are quite profound, obviously not only in Uganda, but in the developing world everywhere. And so I'm keen to explore that a little bit further. So Andrew, you've talked about the quite literally the tragedy of vulnerability of women, for example, in Uganda, and the extremely sad statistic that every hour a woman dies in some type of childbirth-related issue. And I'd like to ask you to help us understand that a little bit further. What portion of these would you consider to be avoidable? And then how does that connect to Mobiklinic's solution regarding the app that you mentioned? If you could talk a little bit more, please, about the app and about data, and how important is data? What is Mobiklinic's ambition regarding the collection and use of data and the relationship between that and the app? So a few questions relating to that as well, if I could ask you just to comment on that briefly.
All right. Thank you, Barry, for the question. Yes, data is also very pivotal to the work we do. You realize that after empowering this community health system with barefoot soldiers, if they call them soldiers on ground, who are arresting the situation, the diseases, and all this. When you have this on ground, you solve a lot of issues to start with. Okay. Now, you realize that once healthcare has been denied to people, it creates a whole sort of problems. There is a population boom because people cannot even access family planning options and services. Then on top of that, there is high maternal deaths. The rates are alarming. And with just a solution that is practical as Mobiklinic, it becomes one key that unlocks and solves all the problems. Now, with our community health workers in there, they not only work on a given set of people, they work on everyone who needs healthcare. They give the first line respondents, including the pregnant women. They go to them for the maternal health support, and these people do it. And you realize when a woman is overdue, a community health provider can use our application to get connected to the nearest health center, or even to call for the nearest ambulance, the emergency response. So there, the digital solution gives them a whole backup of solutions. There is no getting stuck here, because once A fails, there is B up to Z, and all that will work to ensure health services. Now, coming on the issue of data, in the aspect of referral, for instance, it is easy for the health centers to pick up because the ones that are in our network also have our application. It's easy for them to pick up and get and pick up the patient. So it eases referral. Data eases referral. But on top of that, also it makes us a potential partner to decision makers such as the Ministry of Health, because this data is important for them to inform. It can help to inform policies in community. Nice. And there are always new diseases out there. There's always stuff out once you're in the community. So this data is very important. For instance, during COVID, people were having issues with vaccination, and the data of how many have taken up the vaccination, but also finding out, because remember, we have a network of community health workers. These can even help in research. Our data can also help in research. Why is the uptake low? What could be done to boost up the uptake? So you find Moby Clinic has different advantages and different roles it contributes to the health industry in developing.
Yes. Well, that's very interesting. And I think that's quite important, surely, for not only the capability of Mobiklinic as an organization, but the contribution in a broader perspective, and also what do you want to call it, the continuity of Mobiklinic and its viability over the longer period. This data issue is so important, and that does overlap, like you said, with maybe the provision of data to partners, the value that you're collecting, and how that can be used not only for Mobiklinic and for your village healthcare workers and the communities you're serving, but for other organizations. So on this partnership theme, Paul, is that something that you're personally involved in as well? And are there examples of partners that you could cite, or potential partners that you guys would like to engage with in the future?
I hand back to Andrew to broaden it out. I'd just pick up on this data issue. Yes. And the role of good governance and good government, because data is nothing. We're overwhelmed with data, Barry. Statistics thrown at us all the time, but the capability to do something with that data is the important thing. And training up people to be able to analyze data, to pick the substance that they need to be able to take decisions, be it for an individual in terms of an individual health solution, or picking up patterns and trends for what Andrew noted in terms of community issues, diarrheal diseases. We're going back to what in Oxfordshire was 100 years ago, where public health is an issue. But with good quality data, then we can address some of the root causes of health issues. And with that, we have already talked with a company that emerged out of academics and people with quality experience, Simprints in Cambridge, who are very apt at looking at health data. So we've started to explore that, and if anyone is listening in who wants to support quality data turning into information to allow decisions to be made, and us cutting that 25 women dying a day, let's set a target, with quality data and the capability to analyze that data through partners like Simprints. We can make a difference. We can make
Excellent.
a difference.
Yes. Yeah, no, that's extremely interesting. And so I'd certainly like to echo that, Paul. Thank you. So to all of our listeners out there around the world, this business that Mobiklinic is engaged in a partnership exploration with Simprints is very interesting. And am I correct, Andrew, that you guys are open to approaches from any other businesses that might be potential partners that you could work with to enhance the offer that you guys have, and also to explore ways of building on that?
Yes, we are very open. We are very open because currently we are operating twofold as a non-profit. We have the non-profit arm, and then we have the revenue generating, the self-sustaining, and all this is important that we are serving both populations, the low income, and even in low income there are categories. There are the very vulnerable, very vulnerable. So we need partnership with the different stakeholders. We need partnership with like-minded people. We are also open to funding, and also we are fundraising for the arm, where we ready to also offer equity, because we also figured out how we can have this revenue generating arm along with the non-profit arm. And all this is aimed at creating impact in communities, but above all, solving the problem. So we welcome people. Join us journey of revolutionizing and easing health delivery for low-income communities and Africa.
Definitely. We're looking at potential partners you guys have that you're working with already, like you mentioned, Paul, Simprints. And earlier in the conversation, you mentioned Clark University. So, Andrew, could you elaborate a little bit about your collaboration with them, and what's that an example of that maybe other organizations would be interested in?
All right. So Clark International University helps us with, we partner with them. They partner with our professionals in the training, in the pressure trainings of our community health workers. It's a health studies university, and so that's the partnership we have with them. And currently we are building an e-learning platform that is going to be able to impact hundreds and train actually thousands of community health workers. And we are doing this also in partnership with Clark International University. And currently our joint partnership, we are having a conversation with the Ministry of Health to also join us in doing this, because we ease their work, and so that's the sort of partnership we are having with Clark International. We also have a partnership with Able State Creatives, and that is with our software. So we also are open to any software partnership that improves our interface. Maybe for clarity, some software partnerships can distort you of where you focus, but software that can improve our interface, that can also understand what we are doing and improve the interface on every day, like technology, the interface has to go getting improved. For instance, the interface between community health workers and senior medics, we want to right now we added in a chat system in the app, but we also, if we can at a point also have videos and all that, it's all welcome. And so that's largely it. And Simprints, we have a project with them that's its on paper, and we have we paused because we are still looking for a funder for the program, for the project to do with them. So the third need, obviously, is funds and funding, because funds are part of every organization, every company.
Absolutely. So, Andrew, what are examples of, on the fundraising side? You mentioned that Moby Clinic is essentially two organizations. You have the not-for-profit, and then you have the, what do you want to call it, the commercial side of the business or the organization. What are examples of funding bodies for the not-for-profit that would be interested in considering supporting Mobiklinic? So that's the first question. And then the second question is, on the commercial side, the for-profit business, what is it that you're looking for? Are you looking for angel investors or institutional investors? What size of investment are you looking for?
All right, to start with the non-profit, we're looking at organizations that are impact-driven and also the humanitarian organizations. These organizations usually have a mission, and when they partner with an organization like Moby Clinic, we can ease their realization or the achieving of their vision or mission. So organizations obviously like MasterCard, USAID, and different organizations that are into humanitarian, family foundations. Then there are individuals who are impact driven and who support humanitarian work. We welcome them. We've had a gentleman called Professor Tyler Cohen, who is an American economist from the Macarthur Center of George Mason University.
Okay.
So he's been also a strong individual in supporting Moby Clinic. So we're open to search. And moving on to the commercial bit, with the commercial arm, we are open to angel investors. We are open to investment firms because we have a very strong market, a ready market, and we have understood how to commercialize and thrive in this space that is still unexploited. Yeah.
Excellent. I think it's worth just adding, Barry, that this is not for pecuniary gain. Andrew's motivations are clear. His family have struggled. His family have suffered in silence, along with millions of others who have suffered in silence.
Yes.
Those who are looking to invest, we must turn these pious words of environment, social, and governance aspects, the ESG agenda. We have to turn them into reality for the people who do not have a voice. So Andrew is giving a voice through the technology that we have available, through the development on top of that technology, giving a voice to the silent people who 25 women a day are dying without even having an opportunity. So we're looking for social impact investors.
Yes. Yeah. Okay. Well, that's a very helpful clarification, Paul. And that makes a big difference, I think, in terms of who would find this of interest and reasons for getting involved. So thanks for that helpful clarification. Well, look, both of you, congratulations on what you have accomplished. Moby Clinic is extremely impressive. It's obviously a leader in the international field, and clearly, Andrew, your passion and your capability, your intelligence, your commitment are extremely impressive and a great model for people all around the world. And likewise, Paul, your support of Moby Clinic and your commitment to it is very impressive and valuable. I'd like to summarize, if you guys don't mind, very briefly. We have a few more minutes. I wish we could talk for another hour because this is so interesting. Andrew, in terms of Moby Clinic itself, what's your goal for the next year? That's the first question. And then tell us, how can our listeners find you? If you can tell us a little bit more about your website and how they can make contact with you.
All right, thank you. First of all, about the goal, last year we managed to reach to a total of 10,000 people. This year we reached to at least a minimum threshold of 100,000 people and scale up just one district to about 4 districts in eastern Uganda. So that that at least is what we would want to achieve by the end of this year. And with support from different stakeholders and from like-minded organizations and individuals, we can achieve this and beyond. Coming to remind me the other part of the question.
Yeah, no, just tell us, for our listeners' benefit, how do you spell Moby Clinic? What's the website address, and how do we make contact with you?
Great, thanks for that. Moby Clinic is spelled as MOBIKLINIC, Moby Clinic. You can find us in. You can also follow us on Twitter, Instagram, and Facebook. Our website is www.mobiklinic.com, and our websites are on there. Feel free to contact us. You can also find me on LinkedIn, Andrew Dembe with double DEMBE. We are very willing to engage. And we believe that the vision we have of revolutionizing health delivery and achieving health equity is a big one. It's not going to take only us. It will require us to partner with organizations, with individuals and stakeholders, and even development agencies. We need them on board. Yeah.
Brilliant. Excellent. Thank you, Andrew. And Paul, just in summary, do you want to add anything in terms of the asks of the community? So the people that are participating, listening to these weekly episodes are mainly people working in healthcare and technology and innovation. We have investors. We also have people working as healthcare providers, obviously many tens of thousands of clinicians around the world. So that's our audience. And obviously we love to share with them the extremely important and compelling work that Moby Clinic is doing. Anything else you'd like to add in summary in terms of our asks to the community?
Amazing. I listened to one of the previous episodes, Barry, and the gentleman opened up with yet another health acronym. The health industry is as bad as the development industry for loving acronyms. EHW, electronic health records. And suddenly I thought, well, hang on, we've unpacked something. And suddenly I was listening because of what we're doing with Moby Clinic and some of the other issues that I'm aware of, in terms of local economic development, where health and well-being, as you wrote recently, they're intimately interlinked. And the capability of quality people developing solutions for one market, these solutions can be adapted and adopted to meet the needs of other markets. Yes, there is something to be made because we all need to earn more than $2 a day.
Absolutely.
And there is something to be done which puts a smile on people's faces and a sense of pride in contributing. Just ask Bill Gates.
Exactly. Yeah, no, very, very good point. Hey, well, look, I apologize that we've run out of time, but this has been an extremely interesting conversation. Like I said, love to continue the conversation with you. Maybe what we could do is we could ask you to come back and do an episode with us, perhaps 4 months from now, give an update, help our listeners to learn a little bit more about the important and interesting work that you guys are all doing. So until then, Andrew, thank you very much and congratulations. Likewise, Paul, thank you for your valuable time. This has been an incredibly interesting and important contribution, I think, to what we're doing, which is obviously sharing great stories from leaders of healthcare and innovation around the world. So Andrew, thank you. Congratulations. Very proud of what you've done. And good luck with all your very, very important work and all of the success that you've accomplished already. We certainly want to continue collaborating with you and help you to amplify that success.
Thank you, Barry, and thank you to Giant Health as well for hosting me and Paul.
Pleasure. Absolute pleasure. Likewise, Paul, thank you very much for your time. Glad to be in touch with you and certainly keen to continue this discussion with you.
Maybe next time we can actually get some of the people from Uganda, see how the technology works and challenges a few people. We'll be out in one of the districts to hear from people who've benefited from Moby Clinic's work.
Yes, that's a great idea.
There's a
So let's
challenge.
do that. That's a very good idea. Excellent. Well, look at Andrew and Paul from Moby Clinic. Thank you very much. Once again, this has been this week's episode of GIANT's Healthy Innovators TV. We'd like again to thank our sponsors, McKinsey and Barclays International Bank and Vodafone. We're also grateful to all of our other collaborators around the world. My name is Barry Shrier, and I represent GIANT Health, the producer of Healthy Innovators TV. We'd like to encourage all of our viewers and listeners from the podcast to go to our website, www.giant.health. We have coming up in May Healthy Innovators TV programs throughout the year, but also coming up in May, we have European Health Tech Innovation Week with lots of exciting programs relating to all of the latest innovations in technology and some of the biggest ecosystems for healthcare technology in Europe. So again, thanks to all of our listeners, thanks to our sponsors. Great to have today's episode featuring Andrew and Paul from Moby Clinic. We love what you guys are doing and very keen to continue supporting you. Best wishes and hope to speak to you again sometime soon. Thank you.
Thank you.